women give up on mentoring younger women because when you give them space, they try to kick you out because they think they are younger and therefore their voices are going to be more important for obvious reasons in the workplace, right? Because men generally prefer younger women. So there is that as well. It's not just the women with the seat not having the time and the ability to help.
Yep.
It's also the younger women thinking that I can do this better than her and I'm going to take her out. And they can get vicious. When conversations are backed by data, they are factual, they are not opinions, they are not imaginary. And therefore, we can help shape our care and the decisions around our health and the health of our loved ones. Welcome to Unleash Your Inner Goldilocks, how to get it just right. Thank you so much for joining us for another insightful and truly meaningful conversation. Today, we're going to be talking about healthcare and in the reality of what's going on, both in the United States and the world around us, when we think about sustainability and human health and viability. Healthcare is the core of a lot of things that's going on. And I am absolutely delighted for our guest and your opportunity to hear from her, take nuggets of wisdom from her, and incorporate that into how you make your choices and how you make your decisions. So, Dr. Ewa Kleczyk, welcome to Unleash Your Inner Goldilocks.
Thank you so much for inviting me and for the opportunity to speak to your audience, Kas. Thank you.
My pleasure. So as we get started, Ewa, could you take a moment and talk about how you got into this industry and how are you making an impact today?
Sounds wonderful. First of all, again, thank you everyone for having me, and thank you to Kas, and for those of you who are listening all over the country or maybe in the world, welcome. And let me introduce myself. My name is Dr. Ewa Kleczyk, and I have privilege working in healthcare research industry and impacting how we are identifying the diagnostic process, the treatments, and supporting not only patients but also the caregivers who support day to day and take care of those who are suffering with many different diseases. Let me start a little bit about my background. As you can probably hear, I have an accent. I'm originally from Poland, and I came in here for my schooling at a university. I landed in Maine, so I went to University of Maine, did my undergraduate and first graduate degree, both in economics, and then moved to Virginia Tech, where I did my PhD in economics. I always wanted to be a faculty member, but as life sometimes happens, it's landed me actually in the Philly area, working for a corporate organization, doing market research in the healthcare and pharma-related space. So it opened me up into a very different world where I realized the skill sets that I obtained while doing my PhD in economics at Virginia Tech gave me great background and skill sets to apply those towards healthcare and understanding how physicians, how healthcare providers, how health systems decisions, how to treat patients and ultimately provide the care to those who really need it. So with that, I stayed and I started as a statistician, ultimately started going into more managerial. I really love managing and thinking about it. How do we improve the operations? How do we engage our teams? And ultimately landed me in my current position where I work with a healthcare research organization. We do observational studies / clinical trials and have the opportunity to work with medical records and understanding how physicians, how healthcare providers make those decisions, but also what is the patient journey that these patients have. Really understanding where do they go, what types of decisions are being made, how long does it take to get diagnosed, and then what are the treatments and what are the barriers that we still have to resolve and solve for. So that's a little bit of a nutshell. I'm happy to dive in any other aspects of it, but I'm truly appreciative being in an industry where I can make a maybe not so direct, but somewhat indirect impact and drive the innovation.
Thank you so much, Ewa. Ultimately, the research and the data and the insights coming from research is truly shaping and impacting how services are delivered and how solutions are crafted for the healthcare sector. So, two things that you said struck me, and I know our audience are going to want to address both of them. One, you talked about the treatment and the turnaround and the time of the diagnosis and how the treatment is going to be delivered. One, and the other was about the caregivers. I want to talk about the treatment related diagnosis. What diagnosis are we going to move forward with? How quickly can we do this? So, when we go down that path, what are some of the things we as healthcare recipients don't understand, but we need to be mindful of as we plan our own healthcare and the healthcare of our loved ones based on the data that is being analyzed and decisions that are being made?
Well, that's a great question. First of all, I will say something that I read a couple years ago, where it said that we as patients, we are really consumers and consumers of healthcare. If you think about your budget, you spend money on your rent or your mortgage, you spend money on insurance for your car and your food, maybe some leisure activities, maybe vacation, maybe school, school tuition for your kids or yourself. So you're budgeting everything in there in order to ensure that you have the money, and then you are appropriately deciding where the money is going, what is the priority for the given week or month. The same is with healthcare. Healthcare has to be part, first of all, of your budget. You have to manage that and budget that in. And I think that also, because you start doing this, you start also realizing how little we as patients know about healthcare and how decisions are being made. So I think in order to be able to navigate healthcare system, you do have to do a little bit of a research, and you have to be the advocate for yourself or for your loved one. Very often we don't think that as caregivers, we need to know a lot about the condition and also the system, how the system works, all of the how the claims are being processed. What is the timing for those claims? What is your right as a patient or a caregiver to argue about certain types of fees and so forth? So I think all of that background can really help. The other piece is, with as much information as we have right now, and let's be honest, we all are producing data every single day via our devices. And every time we go to the physician office, every time we go into to pharmacy or get labs done and so forth, we are producing data. When those medical records, now we all have access to them, read them, understand them, and really understand what they are putting in there and what they are writing in, because I don't think most patients really understand what it's not there. From my perspective as a healthcare researcher, what we always recommend is leverage the nurse navigators that are sitting within the health systems, because they are your best advocate. They can really help you get those appointments. They can get to refer you to the best physicians, or whether they are in network or out of network, especially for rare diseases or for care, for cancer care, what is required. Really work through and understand so you can be at the driver's seat and leverage the best resources they are. For those with rare diseases or with conditions that are not visible and very difficult to identify and diagnose, for example, like celiac disease, and I actually have celiac disease, so I know the pathway that it took. It's also recording all of the different symptoms that we are having and trying to search and understand and bring them and speak to the physicians. Very often physicians have, or healthcare providers have, only a few minutes. So it's up to us to also be prepared the same way as we're preparing to go to work. I think it's very important for us to go in and say, this is what's happening to me. This is what I am experiencing, because very often for many of the diseases, unless patient speaks up, physician might not see it, or the nurse practitioner or the nurse who's going to be treating you. So you have to be your own advocate or the advocate for the patient if you are the caregiver. So in a nutshell, I'd say is think about yourself as a consumer. The same way as you are doing research to buy a new car, you have to do research to choose the right physicians, to choose the right systems, to go to the places and understand what that condition may entail and what is available, and then have a good discussion. But I would say is be also careful. We are not physicians, we are not healthcare providers, so we cannot, whatever we are reading, we cannot take always at a face value, but understanding what is there, I think helps you to have a discussion that is somewhat intelligent and eloquent in a place that you can actually drive and have a and understand the jargon that is being used, whether in the medical records or in the discussions with those healthcare providers.
Thank you so much, Eva. I have gone through for the last 8 to 9 years with my husband very challenging healthcare situations. He was diagnosed with cancer and Lewy body dementia simultaneously. But what I realized is that I had to be his advocate, but I also had to be very thorough. So one of the things I did is I started, since I come from finance, capturing data, tracking data, and using data to do predictive analytics. That's how we run a business, right? So I took the same approach. I had everything in a data-driven mechanism indicating to the doctors. So I would go to the doctor's appointments with my husband with all my data, with my laptop, everything. And they would always laugh at me saying, I am being a paranoid wife. And because my husband's IQ and vocabulary was so high, they couldn't diagnose, even today, when he's medically at end of life, they can't diagnose his cognitive decline because of his IQ and vocabulary being higher than the average American.
Yeah.
And therefore, it doesn't register on their
Yeah.
methodologies and research, right? So what I have learned through this is no matter what our background is, the loved ones, somebody within the loved community needs to step up and play that role. And if somebody doesn't take that on, then the system will gobble you up and you're at the mercy of the system. So thank you for giving us the blueprint for what we can do. Now, I want to flip to the caregiver, right? Being a caregiver for 8, 9 years, full-time caregiver, sole caregiver, while working full-time, it's hard. But the doctors always say, if this was to happen to one of you, it's happened to the man because the woman is a better caregiver and the woman can manage work and caregiving. But this puts an additional burden on women professionally and societally. Talk to us a little bit about what research shows when women have to give early in life, they're caregiving for their children and raising kids, right? And then midlife, they're caring for their parents. And then later in life, they're caring for their spouses. So the caring doesn't end, and the stress and the toll of on the woman continues through different family members while they juggle work. What does research show about the toll on women, and what can women do to actually protect themselves and preserve what they need to for themselves too, because they still have a life to live?
Yeah, that's an important topic, and I think we are seeing more and more discussion about women burnout when it comes to professional, societal, family related, I guess, activities and our obligations that we carry. I 100% agree with you that we don't think about the burdens, the amount of outside work activities for that women carry when it comes to caring for the family, then caring for the parents, then caring for the ailing husbands or wives or other spouses or close family members that we take care of because no one else can. It are much more resilient than men. Clearly, we are the emotional burdens can be very much taken a little bit differently and coped differently, but there is also women never complain, so the burdens actually are increasing, and having the inability to, or societally not appropriate for women to be complaining about taking care of, because that's our role, right? We are in that role. That creates a lot of mental stress. And I think some of the research are showing that women in their 40s and 50s are actually using alcohol more than even men do. And that is the way of presenting itself that women are dealing with a lot of stress that no one really sees, or it's being either expected of us to do, to be caring of that, or ignored when it comes to how do we actually connect this, how do we help women. So more and more companies right now are moving back to the office. And there's many articles right now that are presenting themselves where they are saying by women, by making all of the employees to go to work in the office 4 to 5 days a week, you are not putting the burden on the men, you are putting the burden on the women, because now, if say you have an hour each way commute, these are 2 hours that you have to plan for now, on top of everything else you're doing, professionally, family related, caregiving, whatever that might be, and it adds to the stress. And a lot of research shows that especially women of color are going to be the most impacted by the fact that they have to go back to work, and adding the additional stress, or adding the additional component of that they won't be able to actually continue the work, and or won't be able to get promoted higher because they will not be able to be in the office as present as maybe their male counterparts. So that's on the professional side. On the more societal side, I think it's slowly changing where women are not the only caregivers. We see more and more men taking care of staying home, and I want to applaud those men who choose those decisions. Sometimes these are related to money. Wife is earning more than the husband, but it sometimes is they want to stay, or both of them stay. They choose different times of the child's raising, and they do this. So I think it's changing a little bit of the expectations of what is required, and also realizing that very often most men are as capable of taking children, caring for children, or even caring for adult parents. It's something that we can all live through. But where I think we all struggle as women is on top of the work, 8 hours at work, we get probably another 4 to 6 hours of the other side, where we really working 15, 16, 17, 18 hours, and the time for ourselves is very limited. And I want to address one more thing. We are hearing more and more women in executive positions deciding to quit. They are quitting what's called quietly quitting. They either choose, they're still working, but they're not engaging as much, and they are not as willing to maybe go up to the next level of their careers, or they are quitting and then ultimately citing burnout. And a lot of burnout happened during COVID because women were doing everything at home. But now, because of how we are changing the engagement level of women and the expectations of women that they have also on the family side, it is creating that unbalance where women in their late 40s, early 50s are choosing to retire much quicker and actually enjoy life. And there is a lot of movement right now where it's actually encouraging women to do that, because life is a little bit shorter than we all expect. And it's that's why you are seeing a lot of women having their own little coaching organizations or other supportive organizations where they can earn a little bit of money, but do it on their way, the way they want it, which again, that's gonna cause a lot of issues, because we're gonna go back to very white male oriented corporate world where nothing is gonna change, and the progress that we have moved forward might not be there anymore. But I went a little bit outside of the caregivers, but I do want to mention that a lot of the decisions that are being done and the way we women are expected to perform at work and at home, I think is also impacting now not only how we give in care, but also where we women in general we are unwinding the trends that women before us fought so hard for. So I'm gonna end at that and see whether there are any questions or we want to follow up on that.
Thank you so much, Eva. I appreciate you touching on all of these elements, because as women, and we have a live audience here, we're all working women. We're all in different stages of our careers, and we are in powerful careers, and we still have to make choices and decisions most men don't have to even think about. So appreciate your insight. And I will make sure our audience have access to your LinkedIn profile so that they can reach out to you, get in touch with you. With that, I am going to open it up to our audience to see if they have any questions for you. Go ahead, Nandini.
Hi,
Dr.
Eva. Hi, thank you. Eva, I really appreciating the amount of care and thought, that you have with regard to the role of women through the stages of our careers and the responsibilities, that we have outside of it. And I was curious because there is a conflict between women as well, where a lot of women in mid-level management roles are not as supportive of other women going higher, like especially in the healthcare field, as a woman physician, I've noticed certain cultural differences between working in Asia as a physician and coming here and working in America as a physician. I was wondering if you have noticed how that impacts women's burnout, if there's any research on that, the effect of patriarchal women on women's advancements in careers.
Yeah, that's actually a very good question and very important question, and I want to recognize this. I think there is definitely an impact. Let's be honest, for many of us who are going through our careers and are climbing, and especially women ahead of us, they had to sacrifice a lot to get to that one boardroom or one corporate table, sit on the executive team or on in the boardroom. So very often, unfortunately, because it was always so scarce and it required a lot of work for these women, a lot of sacrifices that many of us probably don't even know the mental burden that it put on them. I think sometimes the women ahead of us, unfortunately, don't support as much the women in the middle level career, the younger women coming behind them. And I think that is again because they had to sacrifice so much. I do think that societally, this is not a good thing because you also see that women who are younger, who get to, let's say, 40 years old and are not able to break that barrier to move further because they're competing with that one person, that one woman in the boardroom. So they're competing for that extra chair. I think they choose to decide not to pursue anymore and stay where they are. And I think that is probably not a good thing, but because it puts a lot of mental stress, but also creates the potential that we won't be having as many women, and especially women of color, representing in the boardroom. And I think that's a very important thing because it's women ahead of us. I don't know that they sometimes realize that it's not somewhat harmful, that we have to be all aware of it and know that in order to preserve those trends, we have to all work together and bring those women in, because I think there's always room to include someone else or even invite them. Maybe they are not sitting, but they are standing in that boardroom. It's the power of bringing someone in and giving them the opportunity to experience being in the corporate sphere and having the exposure. I think men are doing that very well for themselves, right? Because they go to golf games, they go to whatever football games, they bring their younger colleagues along. And even though they might not be in that leadership position, they are somewhat because those who are bringing them in are giving them nod, right? So they are getting the nod without even anyone realizing. And I think we don't have it. So the one thing that I want to mention is for all of us women, I think we have to do this and be really mindful of the fact that if we don't do this ourselves, if we only gonna care for ourselves, we're gonna suffer mentally. But what it's gonna be is all of the hard work that the women ahead of us done is gonna be broken, and we won't have advancement for women of color, and any minorities, those who are underrepresented in the boardroom. We won't have that impact. We won't have that representation, and ultimately nothing will change in corporate world, and our voices won't be heard. And I think in order for being there, we all have to work together and not compete, because women tend to compete, not compete. See each other as partners, and be okay if someone is better than I am. Be okay with that, knowing that we all can learn, and there will be always someone better, right? So that's that's a fact, and I don't think we have to worry about that. But understanding that that's a good thing if someone more capable is coming in and making a change in the corporate structure.
Thank you so much for that question, Dr. Menon, and thank you so much, Dr. Ewa. One of the things I want to add based on my own experience, I've been a CFO now, gosh, almost 25 years. And in my lifetime, as I have brought young men and women along, I have always found that based on the culture the young women come from, they can be predatory and they will try to take the older woman who's mentoring her out because they think because they're younger, they could somehow appeal to the older men in the boardroom. So that is also a reality. A lot of times women give up on mentoring younger women because when you give them space, they try to kick you out because they think they are younger and therefore their voices are going to be more important for obvious reasons in the workplace, right? Because men generally prefer younger women. So there is that as well. It's not just the women with the seat not having the time and the ability to help.
Yep.
It's also the younger women thinking that I can do this better than her and I'm going to take her out, and they can get vicious. And I have personally experienced this when I have taken from my MBA classroom into the workplace and built them up. And their goal has been to take me down. And so it is balancing that, right? If one person does that, don't shut the door for everybody.
Correct.
Know to read the signs and manage it accordingly, because human behavior is human behavior.
That's, to be honest, that's a point. And it's interesting that women always work against each other, not necessarily together. And I think men, they compete, they don't compete to the level that women do. And again, that's because it's only one seat, right? Usually, while I experience this more as a younger professional, or middle level professional, I tend to experience that. I totally understand that there is the other way, the reversal as well, because only one seat, and it's assigned to one of us, right? So I think we're all gonna be competing, and that's not a healthy thing to have, unfortunately.
Absolutely. Go ahead, Robin. I know you have a question there.
Yeah, absolutely. This has been a wonderful conversation. And I'm going to throw in two questions very quickly. One is how, in advocating for ourselves, like, hey, I'm I'm working full time or even part time and caring for someone. How do you find it's effective to advocate for ourselves without coming across as just being whiny? I think that can be, you're accused of just whining, when in reality, you're legitimately asking, for your needs. And my second question is completely unrelated. Before the show started, we were talking and with you and Nanditi, and pointed out that because she's an ophthalmologist, you're into research into kidneys or liver, and it's like it turns out there's some overlap there. And so I was wondering, what is something really surprising in your research that you've come across that's like, oh, I didn't know that, or oh, I didn't realize that? It's kind of fun, either positive or negative.
Yeah, absolutely. So I'll start with your second question. Many conditions are actually somewhat interrelated, believing or not. Our body functions are impacting, and when you're thinking about how much your liver impacts your other parts of your body, of your well-being, you start seeing that if you don't take care of your liver, your functions might be impacted. The other piece is I always think, having autoimmune disease myself, if you think about it, how big is the autoimmune, I guess, area of conditions? Anything from your skins, your allergies, your allergy to pollen, your allergy to fur of a cat or a dog, or whether you have celiac disease, you have allergies to gluten or milk or whatever else it might be. It is all somewhat interrelated, and all of our functions, what we are consuming, what we are eating, and some of the diagnoses that you are seeing are impacting how your overall body functions are doing. So liver and eyes tend to go hand to hand. The same is, for example, with your gastroenterological and your skin. Very often those are coming together. You see your symptoms on your skin, but it's not really a skin condition. It's what's going on in your gut. And unless you heal it, you won't be able to get rid of that. So I think understanding those connections, and I'm not an MD, I am a PhD in economics, but from the research, there is some kind of connection, and that's why you see a lot of drugs, especially in the immunology, where they start with, let's say, treating rheumatoid arthritis, and all of a sudden they are treating trying to the same drugs for celiac disease or IBD or some other diseases that are in different parts of your body. That's because they have a common start where they are all starting. So that's on that topic. The second, related to your first one, I think, first of all, women always probably get a little bit more that we are thinking, we get the bias of the fact that women think a lot and they are much more emotional. So coming on something as whiny can be seen, especially, I think many women get comments on, oh, this is all in your head, right? Because especially for diseases like I have with celiac disease, which is not noticeable. I don't have any rashes on my skin. The only time if I have a swollen belly when I am exposed to gluten. But when I was saying that I was in a lot of pain and I couldn't move and I was alert, I was very sad, or I was going to almost like a momentary depression. People are saying, "Oh, that's all in your head. That's all in your head because you know the way you are eating or something like that." And I think is trying to understand yourself. That's why I liked what Kas said. Record your own data, bring the data in, say, this is what happened to me yesterday, it's happened to me today. I was, in my case would have been, I couldn't leave bed for 2 days because I was in so much pain and nothing would be helping, or you have diarrhea, or you had a rash on your skin. Record all of this, because I think factually it's easier to talk about it versus talking more, oh, this is how I feel. It's better to say, this is what happened to me. This is what I've had. I had this big whatever rash on my skin. I often take pictures of it and then I have it so I can then show it and say, see, this is what happened to me after I ate gluten, or after I had I also have lactose intolerance. So if I'm exposed, I get certain symptoms. And I think the more factual you can be, the better of a advocate you're going to be for yourself, and also for women especially. Then you won't be saying that we are whining or get comments, oh, it's something just in your head. You have to stop thinking like that because you're thinking negatively. And I think anytime you talk about data, anytime we talk about, I think that it's taken much better, especially in medical setting where you're dealing with a lot of patients. And I don't, this is how our systems work. So I think the more factual information you can provide, the better you can be advocate for yourself, but also then you understand what's really going on with you.
Thank you so very much. Absolutely love a live audience engagement. And Dr. Ewa, I appreciate you making the time, sharing your insights, and truly helping our audience understand when conversations are backed by data, they are factual, they are not opinions, they are not imaginary, and therefore we can help shape our care and the decisions around our health and the health of our loved ones. So it's been an absolute delight to have this conversation with you. And to our audience out there, please remember, while the doctors and the professionals are hyper specialized, our body is an interconnected system with everything causing action and reaction across everything else inside the body, right? The body, the mind, the spirit, everything is interconnected. So how are we eating? What are we consuming in terms of information, in terms of rest, in terms of mindset, in terms of heart set, and in terms of food? All of that matters. And then who are we surrounding ourselves with? And what are we consuming in terms of relationships, and how are they sustaining us and nurturing us? Keep thinking through those and make healthy choices. Because when we consume wisely, we get to live a better life, and we help our loved ones consume better. Then our caregiving becomes easy. And take that thought into the week as you shape your life, and make sure you build a life that is truly working for you and for those around you.